That's my husband.
He's my boyfriend. He gave me this rose.
I told you not to talk about that.
She's very fond of me. She loves him. I know where I am in the rank order. Well, this is delightful. This is, well, first of all, I kind of feel like Oprah Winfrey. It's a really nice looking set. And then I have you to talk to. And this is utterly, utterly amazing opportunity. And as I said, I call this an interview with a legend. And I touched some of the highlights of Dr. Ford's great career and all of her service to mankind, healthcare, etc. But let me just go over a few other things. Some of the questions that I'm asking you, in fact, most of them were gathered via social media. Do you want to ask Dr. Ford? This was in a 24-hour period of time where I just then had to cut it off because I couldn't keep track anymore of who was asking questions. And questions continued to pour in. So people are very, very well aware that you were here and are cheering you on. So let me just, little historical perspective. Born in New York on December 28, 1920, Dr. Ford graduated from high school at age 16. No big surprise, right? Worked as a nurse's aide for a year and a half prior to entering nursing school at Middlesex General Hospital in New Brunswick, New Jersey.
Nursing, secretarial work, or teaching if you could afford the college. We couldn't afford the college. And so I ended up as a nurse's aide at 16, you know.
And then went on to
nurses. Waiting to get to be 18 so I could enter.
Well, obviously you managed to meld the two professions beautifully together. 67 years of marriage, and their daughter Valerie, and I call him their son. Yeah, kind of son-in-law.
He is my son.
He is your son. Valerie and Chris are here with us today. And I would also like to honor them.
One of God's noblemen.
One of God's noblemen. And I remember having a conversation with Mr. Ford when a few years back, and he was with us until the end of 2014 when he passed. And at the talking to him a few years ago, when Dr. Ford was tied up doing something else, and Bill and I had a few moments to discuss, to talk, and he said, you know, Lee had a very responsible job when she was at University of Rochester. I got out of work earlier than she did. So I would make sure that I had a drink mixed for her before she, as she walked in the door, so that you know,
I've been drinking ever since.
Dr. Ford worked as a public health nurse in rural Colorado in the 1940s and 1950s. And how did your military career and your work as a public health nurse influence your thought process as you were developing the concept for the nurse practitioner role?
Well, mostly it was in public health nursing, where I really was the Lone Ranger in many areas of rural Colorado. And I discovered that some of the decisions I'd made at 3 a.m. in the hospital were as really very good training for being the Lone Ranger out in the schools and the homes and some of the hospitals even in rural Colorado. So it probably influenced my thinking about what I needed to know more than what I knew clinically in terms of decision making.
Were you in essence out there in public health like a nurse practitioner without portfolio?
Actually, yes. I was in the hospital at 3 a.m. At 3 p.m. you couldn't make the decision in the hospital. At 3 a.m. you made a lot of decisions. And so,
Amen.
Yeah. Actually, Actually, I think sometimes the hospital nurses don't realize how independently they're able to practice and do practice very competently at 3 a.m. And they don't give themselves enough credit. Clinical decision making that's quite sophisticated, actually. And they knew a lot more than they thought they knew, and they knew a lot more than they showed at 3 p.m.
It's funny, the sun sets, you get a lot smarter.
Yes.
Right?
Yeah,
Right.
somehow or other.
And isn't that interesting? That's a phenomenon that continues until today. Can I ask the AV squad to start running the time, please? So that the time clock. Thank you. And 1965, we have here President Lyndon Johnson signing into law Medicare and Medicaid, and at obviously a rather auspicious time, because that was around the time that you
Realize that preparing functional roles at the master's level was not an adequate way to prepare the professionals, and the transition from functional roles of supervisors and administrators at the master's level was moving toward the clinical roles and the advanced clinical roles. So my job as a faculty member by then was to identify the content and processes of the public health nursing specialty. Pediatrics had its own groups, and so faculty were trying to decide what will be the clinical role of these particular 4 specialties that we had at that time. And so it was, chaos is opportunity. It's the best time to make change in the world, because nobody knows what he's doing and he doesn't care, and nobody does either. So it's a very good time to make changes. People don't realize that, but it's the time to move in and take charge and do something. So we had the opportunity to move into advanced roles for public health nurses and mine was, of course, the care of maternal and child health in the community. And so, unfortunately, that was a little contrary to what the pediatric nurses thought should be done in public health nursing based on their territory.
And are you saying that they were saying you were, with this idea, infringing on what had been the domain of the pediatrician? Or the general practitioner physician?
Well, in the faculty, it was the pediatric nurse faculty, because...
so the nurses were not in favor.
The nurses, it was the faculty of the pediatric nursing department that felt they were doing what we were doing, and why were we doing it? Though I must say that most of their work had been in the hospital, pediatrics, not in the community, because the public health nurses were the ones who did the child care in the community, and that was part of our general domain in families. That's how we looked at the child in the family. So that was a problem, and a very big problem, because there was a lot of resistance to our movement into that area.
I can recall in the late 1950s going out on quarantine rounds with my aunt, who was a public health nurse in the city of Boston. And I was about 7 or 8 years old and being fascinated with the work that she did. So I think from very, very young, I was destined to end up being a nurse practitioner. Although I think back on quarantine rounds with a 7-year-old tagging along with you, that was safe, wasn't it?
Right.
And I know one...
That's how you got vaccinated.
It's how I got vaccinated. Well, and one of my very, very few regrets in my life is I didn't hear more of my aunt's stories before we lost her to the fog of dementia. And because she would tell you stories about mothers lining up. In 1986, there were only 25,000 in the entire country. So this was a profession that has taken a little bit of time to get going, and now we've had explosive growth over the last few years. Here's a quote from Dr. Ford. I've always held Nightingale up as one who did not accept the status quo, who was willing to risk her life and her reputation for the interests of her patients. Any comments you'd like to make on that, other than?
Well, I didn't know that I was risking my reputation and my career. I can tell you that. But you know, I always had a safe haven in my husband and home. I never took work home. You didn't have any idea what was going on, but I always knew that if I got canned, so to speak, at the university, I had a safe haven to go to. I think it's a lesson in change. But mine was significant. So.
He was quite significant,
Yeah.
quite significant. And if we have a healthy population, then we have an opportunity to help the rest of the world. See what happens with the internet? I can just search and I find all these great quotes that you've been said over the years.
I don't even remember what I said. But it is true that a healthy population is a very important national resource. Oils, floors, everything, hard wire, so it has a sense of finiteness. And there's just so much of it. But human capital is ended. It's renewable, it's refundable, it's everything you can think of, and renovations, everything, is one that keeps moving. And as long as it's available and healthy, it's economically wise, it's for a human population. You educate it, you feed it, you keep it healthy, you immunize it, you do all kinds of things that keep the human capital renewing itself. And so we find out that some of this, all the technical things we're doing medically, tend to, maybe extend a little life, but we don't even have great extension in this life compared to other countries. Compared to other countries, we're running 37 on the world population list in terms of health. We pay more, we live shorter lives.
About a population by looking at how healthy the children are within that population and the influences on that. And I see that in my own practice as a family nurse practitioner. And what is often gets forgotten is that in 1965, the PAs got here.
And actually, what I found out, how I dealt with it eventually, it took me a while to learn this, but I worked with a social scientist who was the evaluator of our project. And he was a community developer, had a lot of experience of moving into communities and trying to help them change things. And we came up, and the students and I actually went through this, just looking at theories of change. And in that sense, they took us out of the heat of the day, so to speak, and looked at the problem we were having of opposition from the viewpoint of a theory of change. And when we began to realize that we, the students and I, were creating more of a process of change, it was really it would turn out to be a major change, which I was surprised at. But anyway, and what were the logistics of it, and then what tactics could you use? And a good example is that the pediatric nursing faculty said, we don't know why you're teaching that content, let's say physical exam. Because we're teaching it already. It's part of pediatrics, and then we don't need that. So the strategy then was to find some point of, well, not approval, but some point of commonality that we both were doing. So I chose the physical exam. And I said, well, fine. If we're doing the same thing in pediatrics, I don't want to do it in public health nursing because we could, just join forces. I said, but I'll tell you what I do. The logistics was to set it up so that we could get some data. I said, you can take any 10 of your students and we'll videotape them doing the same procedure. And the tactic was nail them to the wall and crucify them. And so we, you know what? No one ever took me up on it. No one ever, but you know what? They never said that again. It went for a different course of argument. So if you think, but the game, it became a game of change. It was a game. We tried one strategy or one tactic. If it didn't work, oh well, we learned something from that. We tried something different. So when you took it out of the heat of the day, so to speak, and began to look at it more theoretically, it was amazing how much it just diverted our attention from dealing every day with the nonsense of the day.
Yet that you were going to be the rack and ruin of nursing practice.
Of course.
Of course. Of course. Can you share a patient story that stuck with you and made you change or evolve as a provider? This is from Melissa Dolly, who's a new grad NP from Fort Campbell, Kentucky.
Well, I can think of lots of them, but I'd like to tell you two. One was when I was a dean. I went from practice to being a dean, thinking that deans had more power and they could change it. That's a lot of rot. But anyway, that's a side comment. I still tried to practice when I was a dean and teach as well. But anyway, in Rochester, this happened to me after I spent many years as a nurse practitioner and teaching and all that sort of thing. And let's see, it was a mother with a second baby that was I made a home call, and it was because it was after hours and everything. And she was doing extremely well, and I said, you really are doing a phenomenal job as the second child tested. She said, well, I had a nurse practitioner on the first one, so I know exactly what to do. I couldn't think of a more, satisfying outcome in terms of thinking about that.
Isn't that lovely?
Yeah.
To see your own work
right,
loop around.
And also to have the pre and post data. And then another time, which was interesting because you've probably read Esther Lucille Brown's famous book, The Future of Nursing, way back when. Well, Esther Lucille Brown was an elegant-looking social scientist. and she was tall and very, very handsome. And everybody wanted to come and visit us in Colorado. So we probably had to organize visits, but somebody as famous as Esther Lucille Brown, we made some special concessions for. And so we said to her, we think one of the things you ought to do while you're here is to go to a clinic and see a nurse practitioner in action, one of our students. And she said, I think that would be great too. So she went. She came back, and everybody in the school was ecstatic that she was there. I never told anybody she was coming because nobody was talking to me, so I didn't say I said something, but it didn't matter, you know. But then, of course, all of a sudden, everybody wanted to see her. So I said, okay, we'll use the big classroom. Anybody wants to come, I'll ask her if she would come after the clinic visit to tell you. So Esther Lucille Brown comes in this big classroom, everybody looking around at, you know, starstruck. And she said, well, ladies, and she plops herself down and she said, I have just come from the clinic and I have seen nursing in its finest. Wow. That about killed me. Because I thought, oh, this is going to make them really, everybody was just stunned. Yeah. It didn't help any, but after that it got worse. But it was interesting, you know, that she would make that kind of a comment. And I don't know if she really knew there was a great deal of resistance. It wouldn't have mattered to her, I can tell you. She was an observer of nursing, and she
sometimes we need an outsider to tell us how terrific we are.
Yeah.
Me too.
Yeah. My role model, and always been very influential in my life. And so there were no role models per se that I can, because there was no one before me, there were some others. But actually, they're very helpful to you, though, because you learn a lot if you listen to their comment. Rogers was the most vicious one against me.
Martha Rogers.
Martha Rogers.
See, you know, you folks, all these names, Peplow, Rogers, that you're like, oh yeah, they're just people in a book. They were people who walked this earth.
Right.
And we need to remember that.
Yeah. But in a way, they're very useful because they cause you to think about it, they cause you... The national program, they were able to make the changes for reimbursement because it was written into the national rule. And so I think that sometimes we do about things state by state without realizing that maybe we should go after some of the federal nationalization. The VA is trying to get national...
Full practice authority,
full practice authority.
Yeah, absolutely.
And so I think it's important. I think when I said language is important, I don't... And so, you know, we can't... If you haven't read Tocqueville's book on the future, or the creative destruction of medicine, and the patient will see you now, I would suggest you do that. You're going to run to somebody who's already had this kind of a condition, or the group that's working on it. They're going to run to get the information, and then they're going to decide whether or not it's important enough to.
Dr. Nancy DeRubo, who's a family nurse practitioner, consultant practitioner, and practice owner, who actually was one of our great early luminaries. Little something to end the program with. And this is dedicated to the vision of Dr. Ford's in Silver, and it's adapted from the words of a French philosopher. And Dr. Ford in Silver said, "Come to the edge. But the nurses said, there is danger. And Doctors Ford and Silver said, no, come to the edge. And the nurses said, but we will fall. Dr. Silver and Dr. Ford cried, come to the edge, there are people in need. And so the nurses came, among them, the brightest and the boldest, and they came to the edge. And they joined with Dr. Silver and Ford, and they all stepped forward to the edge. And then 250,000 strong, they stepped off, and then they flew. Thank you so much for being here today. And again, it has been a great honor, it has been a great privilege, and if I could just hold you folks for one more minute, could we ask everyone in the room, except for the nurse practitioner students, to sit down? So just leave. And one more, the NPs who have been in practice.
Earl Warren, the late Earl Warren, who is the chair of the SOM. Everything I ever did in life, that was worthwhile, I caught hell for. And I sort of feel like he does. And this is the thing I often end with. I've been kicked and kissed. I've been crucified and credited. I've been reviled and revered, but I haven't been Botoxed or Titoed. Thank you.